Before Lincoln Matthews underwent his most recent complicated heart surgery at Rady Children's Hospital, his doctor held a 3D printed replica of the small boy's heart in his hands to practice the procedure.
This is what it's the size of it and like what the color of it and what it looks like.
After 3 open heart surgeries, the 7-year-old knows a lot about his most precious organ.
It's basically normal. It pumps normally. But sometimes when I'm beating my heart, it stops, but then it keeps going.
He was born with just one working ventricle and a hole in the place of the other. His heart was also tilted to the opposite side of his chest.
It basically helps my body and keeps my body alive.
His 3-dimensional life-size model, detailing every valve, vein, and artery, clearly shows the complication and where doctors would have to reroute the blood flow. The surgery was successful.
Or else I wouldn't be living here today with all of you guys.
Matthew's 3D model was created by Justin Ryan, director of Rady Children's Hospital's new 3D Innovations Lab, which opened in October. It's one of the first 3D hospital labs in Southern California.
So inside here we can see all these muscle fibers. And in this patient, this area is a bit more narrow than what it should be. So we're helping our interventionalists figure out what size of a stent they might put in that region.
Ryan says the 3D models help doctors plan for complicated surgeries and improve outcomes of the region's youngest patients.
So in this patient, there's a hole which is kind of deep inside the model. You know, exactly how big that hole is can change the course of surgical correction. You need to know how big the patch needs to be, where that patch might need to be in order to fix that hole. We can also identify when there's a lot of tiny little blood vessels, which ones might be more critical to save or which ones can be sacrificed in order to help flow to other regions.
Ryan, a PhD in biomedical engineering, churns out about a dozen 3D models every week, from hearts to spines to skulls. To create the models, he uploads a patient's medical images into a special computer program.
And they need to be 3-dimensional in nature. So that's going to be a CT scan or an MRI or 3D ultrasound. And that'll allow us to create a 3D computer model, which then gets sent to a 3D printer.
The models are printed one thin layer at a time using resin or nylon powder or a liquid plastic.
This part will be a bit noisy.
After printing, the models are put into an air blasting machine to blow off the excess. He says creating a spine with airways takes nearly 20 hours.
The heart the size of my hand might be finished in about 4 hours.
Some models are printed in color to make it easy for patients and their families to better understand the diagnosis and surgery plan.
We're able to say that purple chamber is connected to the red and blue vessel, and it shouldn't be that way. You create a new way to communicate with families.
The color also helps surgeons differentiate who's going to work on which part. Dr. John Nigro is chief of Rady Children's Cardiac Surgery and director of the Heart Institute.
We actually sit and analyze the models, and that helps us understand what is the optimal approach to kind of repairing the defect.
Dr. Nigro encouraged the opening of the lab and recruited Justin Ryan after working with him in Arizona. He says the 3D models are crucial.
So they really do help our children who have the most complex and disease and are the sickest. And it really makes a huge difference.
He says holding a replica life-size anatomy in his hands to study difficult anomalies is empowering. He compares working without a model to driving without GPS.
Before, I think we kind of had an idea in our mind, but you know, sometimes we would be fooled, right? We would get in and it was a little different than we had anticipated or than how our mind had anticipated.
He says most of all, the models help reduce the risk of surgery to the child.
We decrease the amount of time that the child is actually on the bypass machine and in the operating room. And that definitely translates to less complications and better long-term outcome.
Little Lincoln Matthews says he's feeling much stronger these days.
Like, I couldn't run that fast, but since like a month ago, I can run like super fast now.
But he faces another surgery down the road.
When I'm 21, my mom says I have to have a heart transplant, and so my mom hopes that they have something to like put inside my body to help it through.
He hopes his experience will help other children facing difficult surgeries. He shares this advice.
Be brave and know that you're very special.
Susan Murphy, KPBS News.